November. It was approved by the board and rolled out, and it is on our website that anybody can access at any time. It's owned by all of us around the table and all of the people within the Southwest LHIN. Many meetings went into the preparation of this, which included stakeholders, our health service providers, community members, a wide range of people, and that input was all used in the blueprint's development. The blueprint ensures that all our health programs are part of a single unified healthcare system, and that we're working together to make sure programs do align. It sets out where we're going for the next 12 years through to 2022. The IHSP is how we're going to reach the implementation of the blueprint. The IHSP is a 3-year plan, and so over the next 12 years, we will have 4 IHSPs that will assist with the implementation of the blueprint. The Integrated Health Service Plan describes the system of care model. It aligns with our provincial priorities, and it provides a rationale for our strategic direction. And as I said earlier, it was developed by provider and community input over a wide range of meetings, which covered the entire LHIN. This membership displayed here are the members of our Health System Design Steering Committee, and we certainly are very grateful to the time and energy they committed. This was not an easy task, and they certainly were very dedicated to the task at hand and provided the information, pulled it all together to ensure that it was the direction we wanted to go. So why was the blueprint developed? Well, as we were working through our previous IHSP, we had several priority action teams who worked together to identify directions. And at that time, access to the right care in the right place at the right time was identified as a priority. The blueprint developed from that. Also, our healthcare providers, as they work through the system, have observed and continue to observe gaps within the system. So as they made us aware of that, we need to work to minimize those gaps to ensure that there is access to care at the right time and the right place. We also are well aware that throughout the LHIN there is inequitable access to care, that not everyone has the same access, and that came out through our presentation from the success story, that the people in Listowel maybe have a more difficult time getting transportation to London, and certainly at a greater cost. So that was one of the issues. In addition, as we are all growing older and we see the population around us as an aging population, so are the health service professionals. So we are going to have shortages, and we want to make sure that we are maximizing the skills that are out there that the skills are being used for the intended outcomes. There are also growing demands for care as we age, and we also want to make sure that every dollar is accounted for and used wisely. We know that there are limited funds, and we want to make sure that we're getting the most out of those dollars. So what do we have now that we didn't have before? Well, we certainly have a comprehensive current state of analysis. We know what's out there, and we're going to use that to build on where we want to go. There's a detailed vision for integrated system of care. There are 2 distinct service delivery approaches, 8 detailed service delivery models, and one high-level roadmap to 2022. This happens through the effort of many stakeholders, and we certainly are proud of the results. So, the 2 service delivery approaches are population-based integrated health services and the centrally coordinated resource capacity. In the presentation earlier, Wendy talked briefly about the centrally coordinated resource capacity. I'm going to start with the population-based integrated health service, which is what we have within our local community. It addresses our total health care, the continuum of care from throughout our lives. It addresses primary care, home and community care, emergency services, mental health and addiction services, complex continuing care, rehabilitation, chronic disease, prevention and management, and long-term care. what we need within our community, and we are the best people to identify that. And in the little blue bubble, it tells you two examples of population-based integrated health services we have now, the Flow Collaborative and Partnerships for Health. The centrally coordinated resource service, it doesn't intend to shift this from a single owner of resources, but rather a coordination, and that's what Wendy was referring to. They've coordinated the transportation services throughout the area. So it's looking at how can we all work together in partnership to make sure that the person who needs the service gets it without a great deal of effort. Are there any? We'll deal with questions at the end, but however, if you do have questions about what I'm sharing, don't hesitate to ask. Mike is here for clarification too, in case I don't have